Good morning. I'm really sorry that I have to join today virtually because of the circumstances beyond my control. I was so excited to be there today in Kolkata. Uh, a warm invitation from Dr. Gautam Das sir and dear Dr. Shushpa, who was coordinating all throughout. Never in my life I had the boarding pass exactly 48 hours before, did the Digi Yatra check-in, but unfortunately the flights got cancelled. It was 7 a.m. flight and return flight was in the afternoon. So the alternate flights which were being offered couldn't allow me the time to be there at Daradia, the pain clinic for this West Bengal ISSPCON. I'm really thankful that I'm being allowed to present virtually, and I shall be sharing my thoughts on building a career in pain medicine. I bring with myself greetings from APMC, AS Pain Management Center, AS A New Hope. Dear friends, if you are positive, you will see opportunities instead of obstacles. The problem is that such a huge population of India is suffering from chronic pain at any given point of time. According to some surveys, it is around 20% at any given point. That means around 30 crore people at a given scenario. And majority of them are suffering from musculoskeletal pain. So India needs lakhs and lakhs of pain physicians. We're roughly around 5,000 now. So it is very, very essential to develop pain medicine as a super specialty. And we, the anesthesiologists, have to build our career in pain medicine because we are well versed with the art and science of treating pain. And our role as a pain physician is a natural extension of our day to day professional work. Never stop learning because life never stops teaching. The main grudge of anesthesiologists is that they are behind the scene. Although this has changed somewhat, but more steps are needed. Once you become a pain physician, there is no such problem because you are in direct contact with the patient and their attendants. It has been rightly said that the good doctor treats the disease and a great doctor treats the patient who has the disease. So, we as a pain physician need not perform, our duty is not to perform some block or other procedures, but to render the patient pain free, to improve the quality of life. To build a career in pain medicine, you need to have a keen interest. You should be a good listener. Listening, and listening is the key to success in chronic pain. We as anesthesiologists always feel that if patient is talking too much, that means he's not comfortable, he's in pain. So we sedate them, we anesthetize them, and make them pain free. But in pain medicine, we have to listen while we are dealing with the patient. We have to understand their patient pain. We have to be very, very compassionate and have infinite patience to listen to their complaints. I wish that you become pain physicians, but how to decide that this is your cup of tea? Look into the mirror, look into the eyes, talk to yourself, and then you will come to know that yes, you are meant to be a pain physician. If you go to a temple, if you worship, and just in that temple when you're praying, thoughts will come, yes, becoming a pain physician is your cup of tea. Because once you choose a field you love, you will never have to work a day in your life. You will be simply enjoying your journey, loving your job. Life presents us many choices. The choices we make determine our future. And that's why you have to make a choice that which super specialization in anesthesiology you want to pursue throughout your life. You should be ready for the new chapter of your life. You have done your MD. You have now have to do a super specialization in pain medicine. Coming to the facts, as is that level of teaching and training in anesthesia during undergraduation, I'm sorry to say, same is the level of pain education during anesthesia PG. There have been revised curriculums by the NMC, but it has not been implemented in letter and spirit. But the best way to get something done is to begin. We have to look for the positive aspects and we have to begin. And you determine that you have to build an exclusive career in pain medicine. Teaching and training after in pain medicine after post graduation is very very important, and the best way to learn is to learn from teachers of teachers. Dr. Gautam Das is not only a national but an international teacher, and he has been teaching so many students over the last decades and produced so many pain physicians in the country who are serving the patients in chronic pain day in and day out. And there are many other across the country, and you can learn from them. There are other fellowship courses and certificate courses in different universities. In AIMS, some of the AIMS DM in pain medicine has also started, and there are fellowships by different societies, especially the Indian Society for Study of Pain, the FIA-PM. And this FNB in pain medicine has been started. It is a very, very satisfying feeling that a 2 years dedicated course in pain medicine, recognized by NMC as an additional qualification, is there for our postgraduates who have done MD, DNB, or DA. My suggestion will be to complete the training as early as possible, preferably within 1 to 2 years of your senior residency, whether you do a fellowship entrance test and FET exam of National Board of Examination, or do fellowships by the teachers or by the different universities. Because there are other pressures also, especially for the ladies, and the parental pressure to get married and subsequently to take care of the children. For the private practitioners, it is difficult to leave practice and lose money and lose practice once you go out for these fellowships. So better be involved in a group practice and complete the training as early as possible. Those who are in government job, definitely they have to take on duty leave and manage accordingly as per the government rules and regulations. But we have to strike a balance between the work and life and ensure that our teaching and training is completed and we become holistic pain physicians. During this training, you will learn the essential skills of history taking, examining a patient, reading the investigations, the MRI, and other radiological investigations, and most importantly, learning the details of the minimally invasive pain and spine interventions, the MIPSs. And it is a multimodal approach to the pain management where you will be dealing with fluoroscope guided or ultrasound guided minimally invasive pain and spine interventions, where you will be learning about the regenerative therapy, including platelet-rich plasma therapies and the radiofrequency ablation, the conventional pulsed and the cooled one, and also dealing with all strata of patients, whether they are of the cancer pain, musculoskeletal pain, neuralgias, spasticity, pediatric pain, so and so forth. Dear friends, chronic pain might be a new epidemic if it is not dealt cautiously. It is the writing on the wall, and we have to accept it. In the government setup, you will have to convince your HODs who definitely expect that you do some anesthesia duties also. You will need to have dedicated OPD days, dedicated pain OT days, need a pain clinic space in the main OPD complex, need support staff and the juniors like postgraduates and junior consultants. And essential equipments like fluoroscope, ultrasound, radiofrequency machine, PRP machine, nerve stimulators, and others. The private practitioners, once they complete the training, initially for few months, they may do simultaneously both anesthesia as well as chronic pain practice, along with the hospital where they are visiting, use their OT and fluoroscope, and subsequently, once the clientage increases, be on the one boat and become a dedicated pain physician. There are other concerns while you're doing pain practice, radiation exposure, the PCP clearances when you purchase the USG machine, and you have to follow the land of the rule of the land. As simple as that. Whatever the law is there, we have to follow that. It is always said, do an ethical practice, avoid unnecessary interventions, do not speak foul about your colleagues or surgeons who have priorly operated that patient or perform MIPSI in such patients. Patients may have side effects or complications, but we should always support our colleagues. There may be certain revisits also. Uh, have patience. Once patient says that pain is not relieved, don't get disappointed. Try to find the pain generator, what we are missing. And once the patient says that I am having very good pain relief, no need to be elated. So have a balance. No need to be too happy, no need to be too sad. So build a career in pain medicine. A country with 142 crore population has around 5,000 pain physicians. There is a big gap, and patients are either untreated or sometimes wrongly treated. The production of pain physician has to increase, whether it is DN courses, you do FNB courses, you do 1 year or 2 year fellowships, or you do short fellowships, do online courses, learn from teachers or teachers. But India needs pain physicians who work exclusively in pain medicine. And it is be rest assured, a pain physician gets a recognition, very good professional satisfaction, lots of remuneration and good financial health, and you can do teaching, training, and research while you are following your career in pain medicine. And the backbone of pain medicine is the pain physician. Always try to build a team of young and old, boys and girls, so that you keep on serving the patients day and night smilingly and relieving them of their chronic pain. I always just show this few slides that in a given day you give 62 patients 86 blocks, the 86 MIPSIs. The OT starts in the morning and ends up to till late night. What I mean to say by these slides is these are the four OT uh, lists of our own team. What we want to show is that India has got lots and lots of patients who are suffering from chronic pain. It is up to us whether we are ready to take up this challenge. The pain team helps you in relieving the pain patients with chronic pain, both boys and girls. And always better to take part in the workshops like the yesterday's workshop being conducted by West Bengal ISSP. And in these workshops, you learn from the practical aspects, the troubleshooting, uh, how to manage these patients, where you are getting stuck up. We also regularly conduct such workshops. This was when the National Conference of ISA was held in Gurugram last year. So the MIPSI workshop was conducted at Rohtak in our center. And you always learn and interact with your seniors and learn the tips and the tricks. Dear friends, I conclude by saying that there are three mantras in life: honesty, sincerity, and hard work. If you follow these three mantras, you are bound to be successful. सामने हो मंजिल तो रास्ता ना मोड़ना, सामने हो मंजिल तो रास्ता ना मोड़ना, जो मन में हो ख्वाब उसे मत तोड़ना, हर कदम पे मिलेगी कामयाबी तुम्हें, बस सितारों को छूने के लिए कभी जमीन को ना छोड़ना, कभी जमीन को ना छोड़ना. And the patients say that we have not lost faith in God. We have not lost faith in God, but we have transferred it from God to the medical profession. And this is a couplet by one of the patient. You get eternal blessings from the patients which make your life successful. It says that you are pious as the name of God. You are the journey to our destination. How will we forget you, dear doctor? You are just like breaths for us. I bow my head in front of all my teachers and parents because of their teachings and blessings. I am here virtually addressing West Bengal ISSPCON and delivering lecture on career in pain medicine. Thank you very much.